Hi everyone, we're back with another live. Hello. We're gonna get started in just 1 minute. We'll start at 12:02. So, looking forward to talking about the COVID-19 vaccines and the technology behind it because I think it's pretty cool. All right, we can go ahead and begin. So hello, my name is Ibukuolua Amale, and I am the new AmeriCorps member on Whitman-Walker's team. So I do like HIV testing as well as social media outreach. And today, I plan to talk to us about the COVID-19 vaccines and their contents and how they were created. So before we get started, I'm just going to say that during the past few months, Whitman-Walker Health's community health department has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STI, sexual health education. We talk about access to care. We talk about the social determinants of health, as well as other general public health interventions. So the next series of outreach sessions will focus on the current pandemic, COVID-19, and the ways to manage your sexual, personal, and mental health. As always, the community health team is here to educate and support you. So today we're actually going to be providing information about the different COVID-19 vaccines and their contents. So currently 184,852,416 people, or that's also 56% of the American population, has been fully vaccinated. And 214,597,690 people, and that's about 65% of the population, has received at least one dose of the COVID-19 vaccine. So although this is a positive trend that we're seeing, to see that over half of the American population has taken the initiative to become fully vaccinated, I still believe that it's important to talk about why there remains to be some hesitancy against receiving the vaccine. And one reason I hear so people don't know about how the vaccine was created or, the mechanism behind it. So that is a valid reason for why people are hesitant to receive the vaccine. So we understand the validity against making decisions about one's health without doing thorough research. So that's why today I will discuss the makings and contents of the various COVID-19 vaccines. So currently there are 3 vaccines available for Americans to choose from. So we have the Pfizer vaccine, the Moderna vaccine, and Johnson & Johnson. So both Pfizer and Moderna are called mRNA vaccines, while the Johnson & Johnson vaccine is a viral vector vaccine. So now you may be asking, what does this even mean? So mRNA stands for messenger RNA, which is a new type of vaccine that was created to protect our bodies against infectious diseases. So basically what an mRNA vaccine does is it teaches our cells how to make a protein, or we also can call this protein a spike protein. And then this will then trigger an immune response from inside of our bodies. So mRNA vaccines are different from other vaccines that we might have been exposed to throughout our lives. And the reason why they're different is they do not actually contain the live or weakened germs or virus. So the myth of you may get COVID from getting the COVID vaccine is not correct, because the mRNA COVID vaccines don't actually contain the COVID virus. It just triggers an immune response for our bodies to then create the protein that can then fight against the virus in the case that we are exposed to COVID eventually. So instead, the mRNA vaccines will teach your cells how to make copies of that spike protein. That way, whenever your body is then exposed to COVID-19, your body already knows how to fight against it, or at least how to fight against it so that you don't experience a deadly case of COVID-19. So the mRNA vaccines cannot alter your body's DNA makeup in any way. So that's one thing I really wanted to stress, is because I know that when people are hesitant to get the vaccine, they're worried about what they're putting in their bodies. And I just want to remind you that you're not actually getting an injection that contains COVID-19. Instead, you're just getting an injection of a protein that will stimulate an immune response. So I also want to note that whenever some people get the COVID-19 vaccine, they actually may develop a mild fever, headache, or chills. But I don't want you to be alarmed, because this is completely normal, and it just shows that the vaccine is working. So if you are one of those individuals that has heard that people got sick after getting the vaccine, I just want to reassure you that it's not that they got sick from COVID. It's just their bodies are actually responding to the vaccine as they should. So now you may wonder, if mRNA technology is new, why would I trust it? And that's a valid question. So although it's a new type of technology, decades and hours and just a lot of funding has been poured into this research and has gone into learning more about mRNA vaccines and their mechanism. So even so, that mRNA technology has been used in cancer research to trigger immune system response to target specific cancer cells. So the mRNA technology isn't only being used when we're talking about the COVID-19 vaccine. It's also being used in cancer research and cancer treatment. So now that we've talked about just how Pfizer works and Moderna, I also want us to talk about the mechanism against the Johnson & Johnson vaccine. So like I mentioned before, the Johnson & Johnson vaccine is made from viral vector technology. So essentially that just means that the viral vector vaccines use a modified version of a different virus to deliver important instructions to our cells. So similar to the mRNA vaccines, like I explained, the viral vectors will also teach our bodies how to make copies of the spike protein that is then necessary to fight the virus when we are exposed to it. And I also don't want to alarm you by saying viral vectors contain a virus that is being injected into you. I want to say that the type of virus that's injected into you is actually harmless, and it just causes your body to be able to learn how to fight COVID-19 when you are exposed to it. So both types of vaccines are effective against the COVID-19. Both kinds of vaccines are effective against the COVID-19 virus. And we just urge you to continue to do any research to discover which vaccine is right for you. But we just want to reiterate that hours and a lot of research has been poured into making sure the vaccines are effective. And just seeing the numbers of individuals that have already gotten the vaccine and are, able to just help us reach this level of herd immunity. We just urge everyone to just do their research to see which type of vaccine is right for them. And as always, Whitman-Walker does offer the vaccine. So if you are ever interested in receiving the vaccine, you can always call us. So before we go, I just want to give you a few reminders about the COVID-19 pandemic and the vaccines. So if you've already gotten vaccinated, big congrats. You've taken a really important step to preventing yourself, your loved ones, and your communities from illness. There's various variants soaring across the U.S. at this moment, and we completely understand why you might want to continue wearing your mask because, like I said, the vaccine is not 100% effective, especially when more contagious variants are spreading, and there are fewer protocols now for people to follow now that they're vaccinated. So just keep on staying alert. And if you haven't been vaccinated and you are looking for an appointment, Whitman-Walker Health does have the COVID-19 vaccine available. So anyone ages 12 and up is eligible to receive the Pfizer COVID-19 vaccine, which, like I said before, is an mRNA vaccine. And anyone ages 16 and up is eligible to receive any COVID-19 vaccine. So to make an appointment, you can call us at 202-207-2480. So the number is 202-207-2480 to make an appointment. And we do want to note that if you are having problems making an appointment with us, there's other places you can reach out to receive your COVID-19 vaccine. So if you live in DC, you can find the information on your COVID-19 vaccine by calling 1-855-363-033. And if you live in Maryland, you can call 855-364-6829. And if you're a Virginia resident, you can call 877-829-4682. And if you haven't been vaccinated and you are looking for an appointment, please continue to follow the CDC guidelines for wearing your mask, social distancing, quarantining if needed. It's really important that you consider getting the vaccine and consider doing the research that will persuade you to get the vaccine. But if you don't, we also urge you to discuss the COVID precautionary measures with your family members and those around you. And like we said, please be mindful of wearing your mask and keeping your distance, especially because you do not know whether the person next to you is vaccinated or not. So finally, just want to give another reminder, we do have the Walk to End HIV this month. It's actually going to be October 23rd. So if you would like to support Whitman-Walker, please register to walk, run, and donate to this year's virtual walk to end HIV. This is a really special year. It's our 35th anniversary of the walk, so you can register yourself or your team for free at walktoendhiv.org. And finally, we really would like if you guys would follow our Instagram, Facebook, Twitter, and TikTok at Whitman-Walker. And you can also check out our website at www.whitman-walker.org. And finally, if you have any questions about our services, COVID-19 resources, you can call us at 202-797-4439. Thank you so much for tuning in today, and I hope you learned a little bit about the COVID-19 vaccines and the technology behind them. Have a great day, everyone. Bye.